Will colonics help my lymph nodes? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us for another podcast. If you're a first-time listener, welcome. Welcome to our journey. And please go back and check out our previous podcast from the beginning of 2021. However, we do have hundreds of podcasts, so we've got a whole library full of podcasts. But for this particular topic, we've been on this theme now for the past
several weeks.
Yeah, several weeks.
This will be our 7th one.
That's right. That's right. So please check it out. And for those of you that are regular listeners or viewers, now that we're on YouTube, thank you so much for joining us again and for being loyal to us. We love you and appreciate you. So what about colonics? Would those help me?
First of all, what is a colonic? Because
what is a colonic?
I actually talk to a lot of patients about colonics, especially ones that are constipated severely. Mm-hmm. And a lot of people don't even know what colonics are.
It's true.
You should start with explaining what a colonic is.
So a colonic is basically it's like a big enema in a way.
It's a glorified enema.
It's like a glorified enema. It's a huge infusion of water in the traditional sense of a colonic, right? I mean, and by the way, colonics have been around for a long time. Mm-hmm. But it's basically where water gets infused into the rectum, and gets into the colon to try to help unload and get rid of the stool, the poop. Okay, or the toxin.
Mm-hmm. And you usually go to a colon hydrotherapist who's been trained in
exactly.
this. They usually do it in a spa type setting where you lay on a bed and they put a tube in your rectum the size of your pinky finger basically, and then they put the water in and they take the water out. Put the water in, take the water out for about 45 minutes to an hour. So it's a session that you go for cleansing,
right? Basically. And there are a couple different types of colonics, and there's what they call a closed system colonic, and then there's an open system. In an open system, if you were to go to a colon hydrotherapy spa, it's very, very possible, high likelihood that the majority of the colon spas out there, colonic spas, are the open system.
Well, they could have both.
Both? Okay.
Yes.
All right. Well, basically in the open system, you put the tube in yourself. You basically are like laying in a really nice, glorified looking, fancy big tub, so to speak. And then you put a tube into your rectum, and then the water gets turned on and water goes in as poop comes out.
Well, the idea with the open system is that water's going in and you try to hold the water as long as you can in, and when you can't hold it anymore, you release. And so you release out into the bed that you're on, but there's a tube there. So it leaves and it goes, and you can actually watch the poop go out next to you so you can see what's coming out.
Yeah.
But in that case, you're in the room typically by yourself. So a lot of people who are a little shy don't want to have somebody with them in the room when they're experiencing something like that. They go to a more open system.
To a closed system.
No, that's an open system.
Right, that is an open system.
The closed system is what I originally described, which is basically where you're there with a tech. The tech puts the tube in. It's a little bit cleaner because the water stays in the tube. It doesn't come out around the tube into the bed. So the water goes in the tube and then it releases out through the tube. So again, just depending on your goals and what you're looking for, you can go to one or the other. We recommend the closed system just because the tech is there with you. The tech can kind of feel as you're doing the colonic where the stool is in the colon. Most people that we send for colonics are very backed up, and they need somebody who knows what they're doing to kind of guide them.
Right.
And kind of tell, look, now that you've been here, this is about how many more you need to clean out. Now that you've cleaned out, this is really how often you should come.
Right.
Things like that. So,
and it's not just constipation. I mean, there are people that have so much gas that their colon becomes so full of gas, it becomes kind of like a balloon. If you think of a balloon that's kind of flaccid at first, and then as you fill up the balloon with more and more air, it gets tighter and tighter. And, especially a long balloon, once it's all filled up with air, it's so tight that you can't really bend it well. Well, that's kind of what happens in the intestine. In the colon, it gets so full of air that it really can't work the way it needs to work. So one of the nice things with the closed system is that there is a lot of focus on getting the gas out. Mm-hmm. And in fact, the first few sessions, the first 1 or 2 or 3, however many sessions it takes, are usually focused on getting gas out.
Yeah, literally, because we typically go once a month for a colonic, and the minute she puts that tube in me, I expel gas out the tube for like a good 5 minutes. I mean, you just see bubbles coming out, and it's crazy because I don't feel super gassy like in general during the day, but there is so much gas trapped in there that you don't realize it. So it's just such a healing thing to do.
It is.
Which kind of leads into why you decided to kind of up the number of colonics you were doing when you found out about what the lymphatic stuff you were going through. Because we were already going to our colon hydrotherapist, kind of for maintenance, but you kind of kicked it into overdrive.
I did. And I want to just say that colonic, the whole topic of colonics is so controversial, especially in traditional medicine. I mean, as a gastroenterologist, a few years ago, there was an article that came out in one of our gastroenterology journals just basically bashing colonics. And, the reality, though, is that they've been around for a long time. They actually used to be a service that was used in hospitals and sanitariums to help people heal as part of their treatment plan. Mm-hmm. And so, there is a lot of controversy about it. We personally believe in them. We've been doing them for a long time. We've actually, it's for many years and have found it to be very healing, very helpful. So
and have sent a lot of patients for colonics.
Absolutely.
That have also had great success.
Absolutely.
And people who have a bowel movement one every other week or once a week, and literally going for colonics is like the only way they can have a bowel movement. I mean, that's serious, right?
That's right.
That's serious health issues, but that's like literally the only way they can have a healthy bowel movement. And I would much rather them do that, right, than not be having a bowel movement.
Right.
So.
And I know some people have said, well, that could be dangerous if you don't know what the colon looks like and there's a tumor sitting there. Listen, anybody that we've ever recommended to go and have a colonic has already had a colonoscopy done with me. And so it's not somebody that we're sending, without knowing what's going on in their colon. Okay. We typically, these patients have already had a colonoscopy, so we know there's not a tumor sitting there or something serious. It's usually just that they're constipated, and people are constipated. Constipation is one of the biggest gastroenterology, one of the biggest GI complaints we get in as gastroenterologists. Mm-hmm. So, and it's a huge moneymaker too for the pharmaceutical companies. There are all sorts of medicines out there, over-the-counter medicines and prescribed medicines for constipation. So
whatever company makes Miralax is doing very well.
Exactly,
Let's
exactly.
just say that.
So the colonic definitely, in our opinion, has a place, okay, in treating several different things, constipation. And so for me, once I, got this finding of my lymph nodes being a little bit enlarged, and I started on my journey of self-care, one of the things that I really started doing a lot of were the colonics.
And in association with your lymphatics.
Exactly.
So that's one of the tricks is going for a lymphatic immediately, then going for a colonic, because the lymph therapist is going to move the lymph, move the toxins, and then you're going to go have a colonic and you're going to release the toxins.
Exactly. So, get him out of there. Yeah. And so I started doing the lymphatics. At one point I was going 2-3 times a week, at least twice a week. And so, I started also upping the colonics and basically got on a routine of doing it weekly. I was doing a lymphatic. And then as soon as I left the lymphatic massage, went straight over to our colon hydrotherapist. And she did a colonic on me. And I would just feel so great. I mean, I'm going to tell you, at the beginning, I was nauseated. And for me, and I think I might have mentioned this already, nausea has always been my symptom that I have when I'm overloaded with toxins or I'm trying to detox, and it's nausea. I don't get pain. Sometimes I get headaches, but usually it's nausea. And at the beginning, when I really started being aggressive with the lymphatics and colonics, I would get really nauseated. I think there was even one night I came home and I just went straight to bed. I was so nauseated. And, but as I continued to do them, it was less and less. Mm-hmm. And so it's just such a great way to detox your system. Okay. Because look, poop is not there to help you. I mean, poop is a waste. Mm-hmm. It's a toxic waste, okay? And if you're not pooping regularly, which most Americans are not pooping regularly, okay? Most Americans are not, then you've got to figure out a way to get that poop out of there, because the colon is made out of tissue, live tissue. There's blood vessels, there's lymphatic, and so that poop has toxins in it. And the longer that sits in there, those toxins will get into your bloodstream and they get into your system, and you do get backed up. Your body gets backed up. Mm-hmm. All right. So yes, I started doing lymphatics with the colonics. And
the other thing our colon hydrotherapist started incorporating with her colonics is doing ozone.
Oh, yes.
So I wanted you to talk a little bit about that, because that ozone therapy, and we can talk about the egg later, but I want to talk about now the incorporating ozone with the colonics, mm-hmm. because literally, like, during your 45-minute session of a colonic, the last 10, 15 minutes, she'll take you off the colon hydrotherapy machine and she'll hook you up to the ozone, and she'll just let ozone run into the colon for about as much as you can handle, really.
Usually for me it's 2 or 3 minutes.
Yeah, just a few minutes, until the colon fills up, and then she releases that, and then she finishes the session with the colon hydrotherapy machine. But you want to talk a little bit about the ozone and what it does?
Well, the ozone is just, it's, if I'm not mistaken, it's O3. Mm-hmm. It's O3, and it's just great for oxygenating your tissue. When she puts it in through the rectum, it just goes through your entire system, up into your liver, and it's just, it's just great oxygenation. And there's different ways to get ozone. There's IV ozone that you can get. In fact, I've looked up here in Phoenix. There are all sorts of places where you can go and get IV ozone. A lot of them are in Scottsdale. So it's not, it's definitely something that is also healing for your body. Mm-hmm. So just another thing that can be tossed in as a little add-on to the colonic.
Mm-hmm. Absolutely.
So let's see, anything else you want to say about it before we...
No, I just
bring this to
it's
close?
Just yet one more thing you were doing to help cleanse the body and clear out the lymph.
My journey has been a lot about self-care, which I wasn't maybe doing enough of because I've been so busy practicing medicine and taking care of everybody else. I really wasn't taking care of myself. But just detoxing our bodies. Our bodies get so overloaded with toxins, in the air that we breathe, in the food that we eat, in the beverages that we drink, in you name it, in lotions, in detergents, in perfumes, just anything is a potential for overloading our system. Okay. And yes, our bodies do detox. Our bodies were made to heal themselves, and our bodies detox in different ways. When we poop, when we urinate, when we breathe out, through our skin, when we sweat, and through our lymphatic. But if you're not taking care of yourself, your body will become more overburdened with toxin, and with time, that will invite disease into your body in different ways.
Well, and the other thing I just shared with a patient today was, he was talking about how he's noticed as he's gotten older, he's getting more of a gut, and it's hard to lose the gut. And this is the same thing. Like when we're young, our detox system is running at high capacity, right? So it's detoxing us. Anything we're exposed to, we're detoxing like crazy. As we get older, everything starts to slow down, including our methods of detoxification.
Right.
So I told him, it's like, as you get older, you have to take time and money, right, and invest in yourself to help get additional help for your body to do its job, right? You have to kind of continue to put time and money into your body to help you detoxify, because it's not doing it at high capacity anymore. And so we were talking about how we're all moving in the same direction. It's just how fast you want to get there.
That's right.
So the more time and the more money you can invest in yourself and helping your body detoxify, the slower you're gonna make getting older. The whole anti-aging thing. You're gonna slow that whole process down.
That's exactly right. And I will continue to say this, as I have on our previous podcast, since we've been doing this topic, is one of the easiest things that you can start doing right now, if you're not already doing it, is drinking a ton of water all the time. A ton of water, okay? Because I realized that was one of my biggest things. I mean, I would get to the end of the day of doing, 12, 14 cases all day, and I would realize that I had only drank like half of a bottle, and I hadn't even gone to the restroom once during the entire day, okay? Your body is going to struggle if you don't hydrate it so that it can flush toxins out. So if anything, drink a ton of water. Don't drink sodas. Cut out the sugary stuff, sugary drinks, the sugary fancy coffees. Drink water. Hydrate, 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 hydrate.
Amen.
All right. Well, on that note, we're going to bring this to a close. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.